I think I've been coming to Dr. Jeneby for, it's probably got to be close to 10 years now. I had horrible migraine headaches. I would, take a medication or a shot, and everything worked for a certain amount of time, and eventually anything prescribed would stop working. And so when he suggested Botox, telling me that it was, something that they had started using, I said, look, I'll try anything. And he was nice enough to tell me, okay, I'm going to give you Botox for your migraines and for your wrinkles. So it's like a bonus, 2 for 1, right? No headaches and you look better. So I am almost 50 years old. So I would say it's even longer than that I've been coming to, because I started coming to him in my 30s. I think there is no better solution for migraines for me. And to be able to go, months and months and not have a headache is amazing. And I have a lot of wrinkles, makes it even better. For my migraines, I get them in my hairline here, and then there's some nerves in the back of my neck. I get them down in my neck, mainly on the right side for me, but on the left side as well. And then I clench my jaws at night, which can cause a headache, but it's not a migraine. So he will inject me here so that I stop clenching. And then, it's helped me immensely. Every time I come in, I'm like, so glad. Today's gonna be a good day.
All right, guys, today we're doing our migraine club. The migraine club is for anyone who has migraines, chronic and or intermittent. And I have a set of about 5 or 10 people that come in every month that deal with this. And I go greater occipital nerve, lesser occipital nerve, zygomatica temporis, the glabella. I also go in the mouth for people who are clenching that also can affect migraines. So Robbie is here, and she's going to show us how badass she is and how she tolerates the injections. Although at this point, when you get a lot of injections, you also, the nerves that are painful nerves are also blocked. I'm also going to use a pain blocker, which is a vibration device that's vibrating. And when vibration and pain are together, it can block some of the pain afferent fibers, which means it reduces pain. All right, here we go. And also, I use Botox a little bit on her to reduce pain. To get cosmetic effect. Now, there's some nerves up in here called the zygomatica temporis I hit. And what's great about Botox, it's not just a treatment for migraine, it's a cosmetic treatment. So she gets a double dip, both in the fact that I'm reducing her fine lines and wrinkles, and eventually she has little to no migraines and is loving it. She also likes me to raise her brows. Mm-hmm. So I'm gonna raise her brows just a little bit, not a lot, and take care of these crow's feet. Robbie, as you know, you don't know, but she's 105 years old. But look how great I've been keeping her. It's sort of like a time capsule, an anti-aging time capsule, a la Botox. And she didn't even know I was doing this for a while. And I did a couple of her friends, and then she jumped in the pool about 8 years ago. Okay, so that's that. I did all the cosmetic portion. Now we're going to do the part where we get into the back. So here you go into the back. We're also going to get the nerve in there. Mm-hmm. Greater occipital, lesser occipital. I do go down her back. She does have a small little area. I think it's right there. Small little trigger point that she doesn't like. I can also inject steroids in this trigger point. Right there. Mm-hmm. Okay. I put a little bit more in these trigger zones. We'll go to the other side just to prevent migraines on the other side. Again, just greater occipital, lesser occipital. Down the neck muscle a little bit. Now we're gonna go in her mouth. She always has gum. It's always really nice smelling.
Spit it out, see?
Oh, okay.
Already.
Open, close. Right now I'm bowstringing her masseter muscle, which is a clenching muscle. Ooh, that one there is really tense. So I'm gonna inject into her mouth. And that's it. That's your migraine club. Plus cosmetic club. So if you're suffering from migraines, call me. Unfortunately, we don't take insurance. Migraine club is about $2,700 a year, but you come in every month, and a lot of people are just off their meds. It is a lifesaver for most.
I don't take any.
She doesn't take any more migraine meds. There you go.
And haven't in years.
So, boom. See you guys soon.
So he just walked out of the room. I don't feel any pain, and I'm headed to the office. So you come in, get it done, go to work. 0 downtime, 0 wait time. Tomorrow I'll look younger or the same age. I'm fine with that. Stuck in my 30s, and I'm not gonna have a headache.